working during your transition in terms of nutrition. Body conditioning score is very important. So drying off cows with body conditioning score 3 to 3.5, maintaining that score during the dry period. So the calf don't lose a lot of body conditioning score, starts to recover.
Hi, welcome to Rumination, the podcast that discusses and shares practical information that impacts the ruminant industry around the world. Hi, I'm Chris Quinn, your host, and today we're talking with Dr. Eduardo Ribeiro. Dr. Ribeiro grew up on his family farm in São Joaquim, a small agriculture town located in southern Brazil. He received his veterinary studies from the School of Veterinary Medicine at Santa Catarina State University in Brazil, where at that time he developed a real passion for science and specifically embryology. In 2009, Eduardo began his master's in the Department of Animal Science at the University of Florida, focusing on reproductive physiology and management of the lactating dairy cow. In 2015, he completed his PhD in animal molecular and cellular biology at the University of Florida, and his doctoral dissertation focused on molecular features in the ovary and pregnant uterus associated with fertility in dairy cattle. In 2016, Eduardo joined the Department of Animal Biosciences at the University of Guelph and is currently an associate professor there. His work at Guelph is divided between research, teaching, and extension service. In 2019, he was received from the Journal of Dairy Science an award for being highly cited in his research. Eduardo's research examines the problem of subfertility in cattle, from the farm enterprise to the cow, to tissue, to cell, all the way through the genes. Current research projects investigate key events in dairy cattle reproductive biology and postpartum health that ultimately contribute to the success of transition cattle management, production efficiency, pregnancy establishment, and of course, survival to term of that pregnancy. And that's what we want to talk about today, establishing pregnancy and maintaining pregnancy through to term, the impact of transition cow health and lactation health, and how that impacts all these things in establishing that pregnancy all the way through term. So welcome to Rumination. Dr. Ribeiro, thanks for joining us today.
Thanks for having me, Chris, and I'm very happy to participate in the Rumination podcast.
Well, it's a real pleasure having you here. So I just want to start off talking about reproduction. Today, let's remind the audience where you see the current status of reproductive efficiency in the North American dairy herd.
Yeah, Chris, so if we look at every metric in large data sets from both US as well as Canada, they tell the same story. And I think the first message that they tell us is that we're making progress, right? So dairy producers, they are improving reproductive efficiency in their herds, at least for the last 20 years. And that's true for US as well as Canada. Another thing that we can take out of this large data sets that are available is that we still have huge variability. So we still have herds that do very poorly in reproductive management and herds that are excellent in reproductive management. And but we're making progress, and it's more and more common to see herds with these excellent reproductive indexes. You know, we're talking about, it's not uncommon to find farms with 28, 30, 32% 21-day pregnancy rate, which is the most important metric that we use to evaluate reproductive efficiency in dairy herds. But when you look at the average herd, there is still a lot of room for improvements. And we move from, 14% 21-day pregnancy rate in 2003, 2005 to low 20s now. So there is still room for improvements. And I guess one of the major challenges we face today is probably pregnancy losses, which is kind of an agreement that although we have made progress in reproductive efficiency, we haven't done much progress in terms of reducing pregnancy losses. We, of course, have done some improvements, but not major. So it is still a problem today.
No, absolutely. And thank you for that and reminding us of that importance. So let's talk about embryonic loss. You mentioned it's a challenge and it's often in the minds of dairy producers today. Looking at the reproductive biology, the physiology that goes on, and your research that you've done, how best to measure reproductive losses after establishment of very early or conception? And what are some of the biological minimums or key performance indicators we should be shooting for? And then finally, how do we minimize this embryonic loss?
Yeah, that's an excellent question, Chris. So I like to facilitate our discussion. I like to divide pregnancy losses in two types. So one is the early pregnancy losses that happens before, early diagnosis of pregnancy. So we're talking about the losses that occur in the first 30, 40 days. And then we have late pregnancy losses, which for the farmer, those losses occurring after the first pregnancy diagnosis. And I'm assuming most of the producers will do that pregnancy diagnosis around 30 to 40 days after insemination. So the late pregnancy losses, it can be measured on the farm. Okay, so it's not a challenge. It's basically the proportion of cows that were pregnant in the first pregnancy diagnosis that do not deliver a calf at the end. So the calf does not survive to term. Although it can be measured relatively easy in the farm, very few farmers know that number accurately in their farms because it has to account for all losses. So it is common to do the first pregnancy diagnosis, a reconfirmation, so people might have an idea how the percentage that they are losing in that interval from day 30, 40 to day 60 to 90, the reconfirmation. But there are also losses after that, normally called abortion by producers. So you have to put those all together. And sometimes people don't do that, or it's not, the information is not entered correctly in their software that they use for management. So if you put all together, it's not uncommon to see farms with 20-25% losses. So we don't have large statistics on that number, which is a problem. So we don't actually know what would be the average in North America. But based on our experience, there's a lot of herds on that range of 20-25% losses. And what producers should aim is to reduce that number the most they can. And if you're close to 10%, I would say that that's good, right? So that would be a target that people should try to aim. But measuring that number, you have to put some thought behind just to make sure that you are accounting for all the losses. So I'll give a few examples of mistakes that people make. So imagine a cow that was diagnosed pregnant, and then she loses pregnancy, returned to estrus, and then is inseminated. Sometimes producers ignore that first pregnancy and just put a new breeding, and that pregnancy is not accounted on those numbers. Another common situation are cows that have an abortion late in lactation. There's no time to re-inseminate that cow anymore, and she goes out of the herd. And sometimes people just enter that the cow was sold without enter that abortion. So it's important for producers to make sure that they have the accurate number. So any losses that occur from pregnancy diagnosis to end of gestation, it should be accounted for, then you're going to have a better idea of how big is that challenge for you in your herd. So getting back to our description of pregnancy losses, those early pregnancy losses, then it's more, of course, difficult to measure in a commercial farm, just because you don't know the percentage they actually had a fertilized egg that could develop into a pregnancy. Unless you're doing embryo transfer, right? If you do embryo transfer, of course, you're transferring a viable embryo on day 7. So basically, every cow should be pregnant at that stage. And then the difference from day 7, from embryo transfer to pregnancy diagnosis, is the percentage of animals that are losing pregnancy. But most of the farmers will be using artificial insemination. So there's not an accurate way of measuring pregnancy losses because you don't know the fertilization rate in your farm. On average, when we do studies, fertilization is around 80-85% for cows that have a successful ovulation around the time of breeding. So then, based on that, you could estimate how much you're losing based on the percentage of cows that are pregnant the first diagnosis. But what you should work is just to try to improve your pregnancy per EI. Basically, if you're doing that, you're reducing failures with, time of insemination, fertilization of the egg, and also early embryonic losses, or early pregnancy losses.
So what are some of the things a producer can do to enhance these or minimize these losses, enhance the pregnancies through to early term and minimize the losses in short and medium long term?
Yeah, so there are a few things that can be done. So one is related to genetics of the herd. So it's not something that will have a huge impact immediately, but in the long term, it becomes important. So it's important for producers to include fertility, health, and longevity traits in their genetic selection program. In the long term, that will help. And as more research is done in this area, more markers are included in those genomic tests. And also more information is provided on the size that people are buying semen to use in their herds. So it's important to keep that in mind as a long-term strategy. In the short term, what you can do in the farm to have a more immediate difference, it will be related to health of the cows in the early postpartum period. Pregnancy losses is multifactorial, so there is not a single reason why a cow is losing pregnancy or not, but postpartum health is probably one of the most important ones. So if you're having a lot of problems with pregnancy losses, or you have a low pregnancy per EI, and you go back to your health information, and you look that you have a lot of cows having retained placenta, metritis, mastitis, lameness, displaced abomasum, pneumonia, that is indicative that a lot of your problem is starting there. So unfortunately, those clinical problems is still prevalent in dairy farms. And although producers have ways to diagnose that problem, treat the cows, most of them will recover no problem. Those diseases, they have long-term effects, not only on fertility of cows, but also on milk production, and as a consequence, in cooling of dairy cows. So cows that survive disease early postpartum, they will produce less milk throughout the next lactation. They will be less likely to become pregnant, and they will be more likely to lose pregnancy if they become pregnant. And the likelihood of pregnancy losses seems to be true even for breedings that are performing perform after 200 days in milk. So most of those diseases are happening the first, 2-3 weeks postpartum, and you treat, they recover. But even after, 7 months of clinical recovery from that disease, there seems to be still an effect on reproductive biology of those animals, increasing the likelihood of pregnancy losses. So that's why we call attention producers to have, a good transition management to prevent diseases. And it's also important to have a robust health program to diagnose those problems as early as possible and treat them effectively, because then you're not going to avoid the long-term consequences, but at least you can minimize. The reason I say that is that there's research showing that the longer the cows stay in the hospital barn, or the more cases of diseases they have, the worse will be the long-term consequences. So if you can minimize the health problem, treat early and effectively, that probably will reduce the consequences that will come later on. So there will be other factors to take in consideration, but I will stop here, Chris, just to not make my answer too long.
No, it's fascinating. And so help me understand more clearly the biology, the physiology of why pneumonia in week 1 or 2 of lactation would impact the maintenance of a pregnancy beyond 60 days at 200 days of milk.
Yeah. So let's think about a pregnancy and why some pregnancies die and others don't, right? Ultimately, it's really the competence of that pregnancy to survive to term. Some embryos or fetuses, they are more competent to develop and survive than others. And the other thing that is really important is the uterine environment. So I like to separate those two things. So the competence of pregnancy to survive and their uterine environment, that should be, ideal for pregnancy development. So when we think about the competence of pregnancy to survive, we can think about genetics, for instance. The genetics is of the embryo now, of the pregnancy, is half from the mother, half from the father. So both can have an impact on the competence of that pregnancy to survive. That's why it's important for producers also to pay attention to the male side, to sires, and select sires that have high sire conception rate and that they are not carriers of the recessive little haplotypes, which are all information that you can get from the proof of the bulls from insemination companies. And on the female side, the genetics is what you have. You have to work with what you have. But there are additional factors that can influence the quality or the competence of that pregnancy, and especially the quality of the gametes. So in the female, in that case, is the egg, the quality of the egg. And what is happening before insemination have an impact on the quality of the egg. So the health of the cow, the nutrition of the cow, those are all factors that can influence how good that egg is to provide all the genetic content, but also the nutrients for early pregnancy development and the competence of that pregnancy to survive to term. Then in addition to that, uterine environment. So the events that are happening in the early postpartum, they also seem to impact the uterine environment. So cows that have a disease like a pneumonia that you mentioned, the uterus seems to be compromised. in addition to the quality of or the competence of that pregnancy to survive. The reason we say that is when we look at reproductive performance in herds performing embryo transfer, where you don't have an impact of the egg anymore, you're transferring a viable embryo, there is still reductions in pregnancy per embryo transfer in that case, which indicates that something different in the uterine environment of those cows there's something different in the uterine environment of those cows. And so to summarize this very long-winded answer, Chris, and I apologize for going around. The reason for the lower fertility seems to be an effect on the quality of the egg that will influence the competence of the pregnancy to survive, as well as in the uterine environment, which will also compromise the survival of the pregnancy in those cows.
And so we know that I believe establishment of pregnancy requires some immune function, right? And is it because we have some impaired or dysfunctional immunity from earlier disease, or are we still searching for the answers related to this uterine health 100 days after a health event that's still impacting establishment of pregnancy long term?
Yeah, that's an excellent point, Chris. I don't think we have the answer for your question. The immune system in the endometrium, which is different from the immune cells that are circulating in the body, they are specialized for that endometrial function and environment. We know that it's critical for pregnancy based on basic science literature done in other species, a little bit in cattle, but we don't have a lot of information in cattle. And there is a chance that maybe cows that have disease might have alterations in the immune function later, including those cells that are, in the reproductive tract, especially in the endometrium. And that might change the likelihood of the pregnancy to survive. But we don't have a specific evidence to, affirm that. And there are other things that can be happening in addition to the immune system, which is related to the overall metabolism of the cows and the nutrients that are reaching the uterine lumen that will support pregnancy development. For instance, something that we've focused our attention in recent studies, and there seems to be changes there.
I know you've done some work on fatty acid nutrition and establishment of pregnancy.
Yes, so fatty acids is something that we've paid attention quite a bit because we observe that there's an accumulation of lipids in the endometrium during those early stages of embryonic development. And those lipids that are accumulated in the endometrium, they seem to be very important for a phase of pregnancy development that we call elongation. That is a prerequisite for maternal recognition of pregnancy and for maintenance of pregnancy. So the embryo needs to undergo elongation in order to survive. And that seems to be a bottleneck on pregnancy development. A lot of failure seems to occur around that time. So that's why we've focused quite a bit in understanding the role of fatty acids on that elongation process, on that accumulation in the endometrium and on the elongation process. And they are definitely important, and we've seen quite a bit of variability from cow to cow, and some of the variability is explained by the health status of the cow. Whether that is the determinant for pregnancy losses or not, we still need to determine. And we're also evaluating alternatives of fat supplementation to see if that could improve the pregnancy development and survival now.
So healthy cows that transition through early lactation is paramount to improving reproduction and minimizing losses. So take-home messages for our audience today, Dr. Ribeiro, what would you remind them to emphasize if they really want to try and maximize reproductive performance and at the same time maintaining those pregnancies right through to term?
Yeah, so I think the first thing, Chris, is to realize that excellent reproductive efficiency is possible. So we've made a lot of progress in the last 15 years. That improvement that we observe in reproduction was done in parallel in improvements in milk production as well. So basically, if you look at the last 15 years, both repro and milk production are going up. And it's not uncommon to find farms with 28, 30, 32% 21-day pregnancy rate with very high milk production. So I think the first message is this, is achievable to have excellent repro and very good milk production, because there is still some confounding of those two traits not being compatible, and that's not really the case. Second thing is, before you focus on pregnancy losses, make sure you fix everything that is easier to fix. So then you can focus on pregnancy losses. So when I go to farms to evaluate reproductive efficiency, first thing we look is 21-day pregnancy rates, the most important. But then that number is explained by other two very important numbers, which is the insemination rate or service rate and pregnancy per EI. So insemination rate is very important. And basically today there's no reasons for you to have a low insemination rate, because in the last 15, 20 years, we just learned how to get cows inseminated. So you should look at your insemination rate, and if you don't have at least 60%, you should work to getting that range, 60 to 70%. So you work with your team to make sure you do a better job with estrus detection, having a fertility program where cows that don't come to estrus will undergo in a synchronization program that makes sure the cow will be inseminated in a timely manner. So make sure you have that first. And then after you have done that, let's focus on pregnancy per EI and pregnancy losses. Then to work on those two things, make sure that your numbers are accurate. So pregnancy per EI, normally we have good numbers in software. For pregnancy losses, not so much, the late pregnancy losses that you can measure, just to see how big is the problem in your farm. And if you realize you have a problem, then make sure you work not only at the time of insemination, which some things are of course critical, time of insemination, have a good technician, semen quality, good sire conception rate, avoid the recessive little haplotypes, those things that we discussed, they're all important. But the success of pregnancy starts much earlier than the time of insemination. So go back, make sure that you know the numbers of cows that are having a clinical problem, and compare with what is described in the literature and try to minimize the incidence of those diseases. Working during your transition in terms of nutrition and body conditioning score is very important. So drying off cows with body conditioning score 3 to 3.5, maintaining that score during the dry period, so they calve and don't lose a lot of pregnancy loss. They don't lose a lot of body conditioning score, starts to recover. then they will reach the time of first insemination prepared to become pregnant. That's what you should aim in your farm. With that, you're going to have a better pregnancy-free eye, and is expected to have a lower pregnancy losses. So, yeah, it's because it's a multifactorial problem. We can spend the whole day talking about different things you could do, but I guess those would be my most important take-home messages to people that are listening to us.
It's a great summary and some great points to take home and apply at the farm level today. So thank you, Eduardo, for that. And again, I want to thank you for your time today on the Rumination podcast and for the research you're doing and for all the practical knowledge that you're beginning to discover and share on and will share throughout your continued career. So thank you very much.
Thank you, Chris. And so it's a pleasure to participate in the Rumination podcast. And also, I'm available to anyone that is listening if you want to interact and understand a little bit more what is happening in your herd. Feel free to reach out, and you can find my email in the website of the university. I'm happy to provide more information if anyone wants.
That's awesome.
Thanks for the opportunity, Chris.
It's our pleasure. And I want to thank our audience today for listening. Make sure you to subscribe to our channel at jefo.ca. And so that, again, refer to jefo.ca and the Rumination podcast to find past and current and future episodes. You can find us at jefo.ca, at Apple and Google Podcasts, as well as Spotify. This podcast was brought to you by Jefo Nutrition, precision nutrition for a growing world. And have a great day.